Broadcast is now starting. All attendees are in listen-only mode.
We will be getting started here in the next few minutes. Just a fresh reminder for everybody that is on here, we are going to be working with Jeff Pallo today. He's our contact over at Pinnacle Financial Services. We do a lot of our back office with. He is going to be the one that's going through Connect for Medicare for everybody. I'll do a short introduction. If you have any questions, feel free to type them in there. We will stop as needed and go over the questions. Everybody will be muted, so make sure you do chat it in the questions box, and we will go over it. Today we are, as I said, going over the Medicare Advantage enrollment portal. Jeff's going to go through it thoroughly and show you a little bit of how that works and the convenience that it brings to you on the Medicare Advantage side. The majority of the attendees that we have today, you are contracted with us, so if you have any questions, concerns, anything that needs taken care of here, the busy season is starting, as we know, here in the next 4 days. Let me know so I can get with Jeff over at Pinnacle or with the carriers directly, whatever it may be, to take care of any issues or questions that you may have. Okay, we are at the top of the hour here. I know everybody's time's so sensitive here this time of the year, so we're going to get this started. Uh, Today, just to go over again, we're going through Connect for Medicare. So many of you that are on this webinar with me today, we're also a part of the CSG quoting tool. That's also the Medicare supplement enrollment tool. There's a couple features that we went over. We did go over that if you were with me then, and we're actually going to be doing that again on the 18th. So make sure you check your emails for a webinar invite. They'll be going out for that. But today we are going over Connect for Medicare. So this is a complete CMS compliant tool. It is a program software that acts as almost as a CRM for comparing and enrolling the Medicare Advantage plans and prescription drug plans. Jeff Pallo is one of our panelists today. He works with me over there at Pinnacle Financial, helps me with a lot of the sales support things on my end. As you know, IAMS, many of you know IAMS is a very large annuity shop, and we are kickstarting, getting more aggressive in the Medicare. That is what my background is in, is the Medicare side of things. So I come from a very large brokerage of the Medicare, came over here with IAMS, and we are kickstarting this. We have some pretty good traction going on thus far, so make sure you keep it coming. But if you have any questions, anything of that nature, again, you can type them in the questions box. I will try to stop it as we go to answer any of these questions that we may have, as well as just know I will be following up with everybody as we can. One question we have is, will there be copy slides available after the presentation? We are recording this presentation as well, so we will email that out. We do a little bit of the editing and things of that nature to really hit on what's really needed. But we will be editing it and we will email it out. It'll be also a part of IAMS's YouTube page. And then, like I said, I will be following up with everybody probably next week. I have to take off early today, but probably early next week you'll hear from me. I want to make sure everything's going smooth, and we'll kick it off from there. So with that being said, I'm going to hop off of here, and I'm going to pass it over to Jeff Pallo over at Pinnacle Financial Services. Again, Pinnacle Financial helps us a lot on the back end with not only the back office support, but Jeff works very closely with me again on the sales support side to make sure we're providing everything that you possibly need to be successful in this market. And with that, I'm going to pass it over to Jeff.
Good morning, everybody. As Alex said, my name is Jeff Pallo. I work here at Pinnacle Financial Services. We handle strictly the Medicare side of things here, so all the Medicare tools, product questions, anything like that. Of course, go to Alex if you ever need something beyond that. I'm sure he'd be happy if you'd reach out to me as well, and that includes this online enrollment tool for you. So first thing I want to say is we've been getting a lot more traction on this year than even last year, due to the changes in the Medicare Plan Finder that's happened. I'm sure any of you who have been doing this for several years in any capacity have done drug lookups through that tool in the past. You've noticed is they made a lot of changes in not only the way it looks, but the functionality of it, to where it's a lot more difficult to go back and see the saved quotes that you've been able to do in the past. You have to actually create an account for the client or have them create it, and it takes a little bit of that outside of your control. So this system that we have here, Connect for Medicare, is created and maintained by the same people that do the Medicare.gov website, which means the numbers and the functionality all will be very, very similar, except for you'll be able to actually do the enrollment straight from this after you've done the quote side of it. This will show all of the major carriers are on here. So Aetna, United Healthcare, Cigna, Anthem, Humana, WellCare, and then several of the local carriers in the different markets, depending on where you are. Again, you can run the quote with the actual drug costs on there and the plan costs, and then you can enroll right from there. And I'm going to get into the specifics of the functionality and how it works as we go. So first thing I want to show you is how you get to the site. The web address is connect and the number 4 Medicare.com, connectformedicare.com, and that takes you to this website here. You'll see there's 2 buttons. The 2019 site is if you still have somebody to enroll for November or December effective dates. The 2020 site is for open enrollment. So that is up and running and live right now. So once you go into the actual year site that you want to, you'll have a login. So anybody who is currently contracted with IAMS for the Medicare products already has access to this and has a sign-in. If you're not sure what it is, reach out to Alex and he can get it to you. But anybody who is active with any of the companies in any of the states will automatically have this. So just a reminder, this is only going to show you the companies that you're actually licensed and certified for and the states that you're actively appointed in. Okay? What that means that's important is if you don't see something on here in one of the states that you're in, or you think there's a company missing, there must be something wrong with the contracting of the certification or appointment side of it. So that's a good reminder to reach out to us or to IAMS, and we can make the adjustments to make sure that you're set up how you need to be. Many of the agents don't realize that even though you may be licensed in a number of different states, you don't actually get appointed there unless you specifically ask for it. And all of the carriers on the Medicare side are going to charge you a fee for any states that you're a non-resident in that you want to add an appointment. So that's something to remember. We do get people who ask for a number of different states up front. I always like to remind them, maybe you don't want to add those until you know there's a case that you're working on there. If you just want to see all the different products that are available, even if you're not set up yet, just to get a feel for what's there, you can always do that through the IAMS CSG site. That will have all of the product benefits and names out there available for you. You just won't be able to do a specific drug quote through there. But that's a good way to at least find out what's available if you're not sure. So once you log into the site, you're going to see your agent dashboard. So you as the agent, as you start to use this and create profiles and do enrollments, they're all going to show up here. So it'll do a little bit of tracking for you. It's not a full CRM, but it will save all the clients' name, address, phone number, all that kind of information, and the plans that they enrolled in. All of this is saved compliantly to the CMS rules. So any scope of appointments or applications that you do through here, it will save them for the 10 years or lifetime that is required. Okay, so we just had a question. Somebody asked if Medicare supplements are able to be quoted through here. The answer to that is yes, some of them. So this does Medicare Advantage, prescription drug plans, and Medicare supplement. The supplements that are available and approved as of right now are only United Healthcare and Cigna. Okay, we're working with the others like Mutual and Aetna and Humana. They should be on here at some point in the beginning of the year. It's just a matter of them approving it. Anthem, for those of you that do Anthem, that is on here for the supplements as well. Okay. So as I said, this will be your dashboard. This is the home page that you're always going to come to. To start doing a consultation or a quote, you want to go up to the top here to the Start Consultation button. You see there are other options, so you can actually go immediately into an enrollment or to a quote, but we don't recommend you do that. So you want to always do Start Consultation. That's going to save the information for everybody, anybody that you enter in here. That's how it would save that profile for you. And to that note, the Search Profile button is how you would find that person when you come back in. So good example of that is there's a lot of agents who maybe have one of the carriers like Humana or Aetna introducing a new plan in their area that might be a little bit better than the one they were on. They can go in, find everybody that was on that plan, go into their profile, see all the drugs that they put in for the last year, and automatically run that quote and see if the new one is in fact better for them. Okay? So we're going to go ahead and start a consultation. I'm just going to use myself as an example. Okay, so you can see only certain things are required. I always recommend if you have the information, fill the rest of it in. Anything that you put in there will automatically transfer over to the enrollment if you decide to do the enrollment through here. So you won't. It's not that you have to type it twice. It's always a good thing to save it here because then it saves in their profile forever. Okay. The send access to consumer site button right below that is not typically what you would use. That button is really more for if you just met somebody who asked you to send them information and really didn't have time to talk or go through a full consultation at that time. That's where you would hit that button. That would email them access to this site tied directly to your writing numbers and companies that you have available, which means if they did decide to enroll through you sending them the access to the site, you would still be the agent of record and be paid on that case. Okay, but most of the time, how you would end up using this is either sitting at the kitchen table across from the client and doing it with them, or over the phone. So in those situations, you would just hit continue. Okay, and on any of these pages, when you hit continue, it's going to jump you to the next tab. If you're back in somebody's profile, or if you don't need to do some of these different pieces, you can jump ahead to any of those tabs at any time. You don't have to skip. Nothing is required for you to move on. Okay? So the first thing you can do is scope of appointment. Okay, you will have access to that through the IAMS CSG platform, but you can do that through here as well. Okay, so we just got a question. Somebody is contracted with another FMO, and they're looking to transfer their business to IAMS. Will that client and business information transfer over to the Connect for Medicare tool? Okay, so in the past, you would have had to manually transfer the information over, but if the other FMO you're using has the same Connect tool, we can try and work with them on the back end to see if there's any way to just transfer it automatically, since it's the same tool that's being used. But that's something that we can take offline and see if we can get taken care of for you. So I'm going to use a separate email just to show you exactly what the scope of appointment looks like. So when you're using this tool to enroll people, if you're doing it over the phone, the carriers, all the carriers, I believe, except for United Healthcare, the client signature portion of it is just a checkbox that says, I am the person on the application, or I'm simply helping them to do the enrollment. So you can do that over the phone, theoretically, without ever having the client touch it, which, obviously is a dangerous thing in case there would ever be a complaint or something. So if you're going to do that over the phone, I always tell the agent to at least get the scope of appointment done through the system, because that way you have some type of tracking back with the client. Okay? So we sent that scope of appointment. This is the email that the client would receive. So Kevin Shields is the owner of Pinnacle here, so he's showing up as the agent. But in your portal, this would be your name here. You see it fills it out. Little message to the client. Again, your information at the bottom. All they have to do is click the big yellow complete scope of appointment form. They only need to fill in the required information here. So you can see it looks just like a regular scope of appointment form. You'd want to have them check the 4 products, put their first name, last name, and you can check the box as the signature here and submit it. So again, they do not have to fill all of this in. They can, but they don't have to. So if you're sending this to someone, they do have to have an email, but this is all they have to do. Okay, hit submit. That completes the scope and puts it back into your hands in your system. So back in your agent portal, in the scope of appointment page, if we refresh it, you'll see now that that scope we just completed shows up at the top. Okay? So that means the client portion is done. You now have to do the agent portion. So that link that said finish scope of appointment, you're going to click that and then put in your agent information. Okay, you can see, as usual, it has the same things that are on the bottom of the paper scope. go ahead and fill this in. And you see you check this box off, and that's your signature. You hit submit. That completes that scope of appointment. And you can see that says submitted. So that's done. Some of the carriers will ask you in the enrollment portion for the scope confirmation number. That's this number here. Okay, if you want to save that or copy and paste it somewhere to use. Also, new for this year in 2020, if you click that link for the confirmation number, it now allows you to download that scope so you can keep it on file if you like to keep electronic or paper copies yourself. Okay, so that's done. The scope is done. You can now move on. If you do an electronic application through the system from here, the scope will transfer over with the application. You don't have to do anything special. So we'll hit continue. It's going to move us over to the health tab. Okay. Now, the plan comparison that we're going to see at the end is going to have an estimated cost for the year for the plan. So that's going to not only include the premium, it's going to include the actual cost of the drugs based on what we put in. And it's also going to include an estimated cost for the medical. Okay. And the way that they're going to estimate the medical cost is through what you enter here in this health tab. So based upon the age that you use and the health condition, it's going to assume, higher or lower plan utilization. So somebody you would put in, poor health or an older client, they're going to assume that they're going to use this more often, more specialist visits or hospitalizations or what have you. Okay, and a good thing to know here too, you can see there's blue question marks. Anytime you see those anywhere in the system, it's going to give you some pointers and some help on whatever you're looking at. So you can see it points out how they specify what good, fair, and poor health are. Now, rule of thumb that I always use for the health section is unless you know somebody is sickly and going to the doctor a lot or, is going to be using the plan a lot, I typically will always select good health. I think it overestimates the usage for good health. So it's a good place to start. Unless, like I said, somebody is going to have a lot of utilization, then, use one of the higher ones and you can always come back and give them the good news that it's less, So we're going to move on to the next section. This is where you can actually specify what level of federal subsidy they have, if they do have it. So if they're a dual Medicare, Medicaid, you can specify that. Any of these other things, so Medicare savings programs, full extra help, partial extra help, right? And if you do select those, it'll automatically adjust not only the premium of the plan, if there is one, but the drug cost as well, okay? So in this situation, I'm going to click uncertain so you can see. Now, this is the drug lookup portion. If any of you have used Medicare.gov before, you're going to notice this looks fairly similar once we start using it. So you start typing in names of drugs. It's going to automatically pre-fill them for you. So you click on it, and then it allows you to change the dosages to whatever the client has, and then you add the drug to the drug list. Okay, I'm just going to use a few different ones we get fairly often. Okay, now this is one I want you to pay attention to. I'm going to put in Synthroid. So Synthroid is a brand name drug. So you see when you go to put that in, it alerts you to it. Okay, so what happens a lot of times, for those of you who may not have done a lot of these appointments, is the client says that they take the brand drug, even though they're not really taking the brand drug. So there may be some of those out there that you may not know off the top of your head. When you're putting it into the system here, it's going to alert you to that, and you can ask them, are you really taking that brand, or are you using the generic? So in the case of Synthroid, the generic is levothyroxine, and it's going to automatically adjust that for you. Okay, so we just added those three to the drug list. We're going to say that's complete. If you need to add something later on that they forgot, or if you're coming back into the system at a different time or the following year, you can come back in here and adjust this anytime you need. And like I said, you can move forward in the tabs anytime you want. You can also move back and adjust anything anytime. So one of the things in the pharmacy selection that's different from Medicare.gov is that you can only select one pharmacy at a time instead of two. So what that means is if you want to see the difference, let's say, between CVS and Walgreens, because CVS is the preferred pharmacy for Aetna and Walgreens is preferred for United Healthcare, you would just have to select the pharmacy, go to the plan comparison, and then come back to the pharmacy, switch it, and then look again, and then you can see the difference. Okay, but it automatically is going to input their zip code and show you everything in the immediate vicinity. So I'm just going to choose CVS in this example, and we'll continue. Now, I picked the zip code of our office, but you would obviously use the ones in your area. Okay, so you can see it has Medicare, Medicare Advantage prescription drugs, prescription drug plans, MA only, or Medicare supplement. Okay, it's going to sort those according to the total estimated cost for the year. And remember, that includes the premium, the medical cost estimate, and the drug cost. Okay? Now, the reason I chose uncertain when we were looking at the subsidy is to just show you that if you do that, the dual plans may show up. So you see it'll say SNP. Just be aware of that. So when you're going through this quote, especially if you're sitting in front of somebody, that you don't accidentally choose the special needs plans if you didn't mean to. Okay? So you can see it has all those different carriers we discussed that are in this area. Now from here, you can either look at an individual plan's full benefits more specifically. You can look at multiple, up to 3 next to each other. You can send an individual quote, or you can enroll. Okay. One thing you'll notice on every page from this point on, you'll see the enroll button as an option. So you can always jump to that whenever you need to. In the enrollment section of any of the companies, they're all going to look a little bit different. There's a few different types of enrollments on here. There's internal and external. So an internal enrollment basically means it'll stay within this one system and let you do it through there. External means it will jump you to the carrier's website to do it through their online enrollment portal, but you'll already be logged in and it'll be coded to you so you won't have to redo everything. All the information that you've already put in will be saved and transferred. So for this situation, I'm going to pick a couple of different plans. You click check to compare. Okay. And you can click compare now. And that'll show you the 3 plans that you chose side by side. So this gives you a little bit more of the base information of the plans that everybody looks for. So your PCP, your specialist copay, skilled nursing, ER, the main parts of the plans that everybody asks for. Okay. You can send, again, any individual quote right from here. You can enroll right from here, or you can send a multi-plan quote. Okay. Now, just to show you what the sending of the quote looks like, we'll do the multi-plan example. So you can put in your own message. You see all their information is in here. Now, one thing to remember, anytime you send a quote through here, or if you send an enrollment through here, they're going to ask the client for this code. So that code serves as a verification of their identity, essentially. Now, for you as the agent, this is the only time you'll see it. And it auto-regenerates every time you do a different quote for somebody. So what the agents do a lot of times, will keep an Excel file with the names of all the clients and then the codes that they use when they send it. It's not quite as tedious as you would think because the client will get a separate email that shows that code that they can copy and paste. But, as always, if you're walking them through this, you want to have that on your own so you can repeat it back for them if needed. So we'll send this quote as an example. Now back at the client's email, you can see they got the quote itself and the code as a separate email. So the email with the code makes it very obvious what it is. You can tell them they can just copy and paste that. Okay? And if you look back at the quote itself, you can see you have the little note that we typed in. Again, you can personalize that part of it. It's got your information always. So if we view the quote, you see the first thing they're going to ask that client, what is that authorization code? So they just paste that in there, hit continue, and it's going to take them to a quote with those specific plans that you already pre-chose for them. Okay? You can see it looks a little bit nicer. It's client-facing instead of agent-facing. So it's going to have all the information we already entered. They can click and look at the drugs if they want to. They could see that you chose the pharmacy that they told you to, and it's got all the plan information. So now, if they were to enroll from here, you again would get credit for that and get paid. Okay? Again, you can send one company, two companies, or three companies. So really it just allows you more control over what's going on versus you just sending them that consumer site for them to pick on their own, right? So back in the agent side of it, if you wanted to see a breakdown of what the actual drug costs were, so you see here on the left-hand side, you got the premium, the estimated medical costs, and then you have the drug costs, right? And that gives you the total cost for the year. So if you wanted to see a full breakdown as to what the drugs were and what that costs, you go to the View Details button. Gives you more information, and then you can click to see the ads by month, and it gives you a bigger breakdown of what the actual drug costs are. So you see it's got the retail before the donut hole, during the donut hole, and after. Obviously, these drugs were all generics, so it's fairly inexpensive. But if you were choosing some of the heavier duty medications, like the insulins or something like that, it'll tell you exactly when the person gets out of the initial coverage phase, when they get into the donut hole, when they get out of the donut hole, and what they're paying every single month along the way. Okay? We had a question, can you use the tool to sell in other non-resident states without having actually be with my client? The answer to that is yes. So again, any company, any state that you are appointed in with any of the carriers will show on here. Okay? If you're using one of the carriers like Aetna or Anthem, where you can click the signature for them, you can just do that while you're speaking to them. If you're doing a company like United Healthcare, you would simply send them the enrollment electronically through here, and they would have to do a signature using their mouse. Okay, but you can do it all over the phone. So a good example of that is I think we did about 7,000 enrollments through here so far in the past year and a half. There are some agents that use this for every sale, where they actually bring a second monitor with them, and they sit across the table and have the client look exactly what they're looking at. But the majority of the agents average around 15 to 17 apps through here. And that really came in a couple of situations. One, if they were in a different state where they knew they weren't going to be driving to them, or, it was bad weather, or it's somebody who lives 4 or 5 hours away, and they did it over the phone. Or, it was just somebody like Aetna or Humana, where they have a bunch of different plan kits in a bunch of different areas in the state that you live in, and you can't print the application because they're all individually barcoded. So if you have an application that day, or you have a appointment that day, and you don't have an application on hand, you can at least use this tool, and you can still do the application. You don't have to wait. Okay, so that was actually the majority of situations where agents used the tool really out of a matter of necessity in certain situations. Okay, and the more comfortable you get using this, the more I think you end up moving over to doing this for everything. This site that I'm using now, and even your own site, they're all live as we speak. So you could physically do an enrollment right now if you wanted to, but you can also come in and test and move around and do, fake clients just like we're doing here, so you can get comfortable with using it before you're actually doing it in front of a client or over the phone. Okay? Really, the only thing you don't want to do is actually get to the end enrollment portion and hit submit. That would actually send it to the company, which has happened on several occasions already. But you can get all the way to that point, and you can still, mess around and nothing will cause a problem with you at the carriers. Okay. So, just to give you an example of what it looks like when you want to do an enrollment, I'll use Aetna for an example. So you go down to the Aetna plan. Let's say they want this. You click enroll. You see, because we're on the 2020 site, it's not going to allow you yet. Okay. Once we hit the 15th, it would take you right into the enrollment through the website. You don't have to go to a different site. You don't have to log in somewhere different. It'll take you right to the application. You can do it while you're sitting there or while you're speaking to them over the phone. Okay. A couple other features to show you before we finish up that really are what I use this for most often. On the bottom of any page they are on throughout the system here, you're going to see under the resources section, the physician formulary or pharmacy finder. If you click that, it's going to show you every single company, and it'll have a quick link to the formulary or pharmacy or physician lookup. So instead of having to have, Cigna, Aetna, Humana, United, Allwell, all of those companies saved on your browser and have your login saved, you can use this to jump right to that page where you can look up the doctors. So you see, I clicked, takes you right to Aetna's doctor lookup site. That's it. Okay, so you can get to that a lot quicker and a lot easier through the system. Okay. The other thing, and the last thing that we'll go over, and what may actually be ultimately the most important, at the top of the page, next to your name as the agent, you'll see My Account. If you click My Account, it'll have everything that'll show for the client, so you can change your phone number or email if you want to. But more importantly, you see URL link to, that is your personal URL as the agent that you can use to make an enrollment or quote button on your website if you already have it. You can put it up on your Facebook page if you have one of those. Or if you don't have a website already, we can teach you, or Alex can teach you, how to take this link and create your own website. Okay? So you can, at any time, buy yourself a domain, take that link that we just used, and create your own website. It would take you 15 minutes to do the entire process, and a domain will only cost you about $12 to $18 for a year. Okay, that's it. So this is what the client-facing agent website looks like. So that was that personal URL. You see it'll have your information as the agent at the top. And if they click and create an account or do an application through here, you get paid as the agent. So just as an example, I bought, because we're in Pennsylvania, PAMedicareplans.com. So PAMedicareplans.com links directly to my agent portal. You can do the same thing, okay? If you're not sure how to do it, we can certainly have a call outside of here, or Alex and I can have a call. It's very, very simple. All you have to do is buy a domain, and then you can tag your agent link right to that domain. It's very, very easy. If you haven't done it before, you can buy it through Google, or GoDaddy is another big one. So,
and Jeff,
just to show you what that looks like.
Jeff, can I jump in there real quick? One of the things I know a lot of you have seen, and Jeff, thank you obviously very much. I'm going to let you finish up here in just a second. But a lot of you, because I know some people are starting to drop off here, when I have talked with many of you, because many of the people that are actually on this webinar are actually contracted here through IAMS, one of the things I have brought up to you is our creative team. Part of our creative team what they do is website building and development. So this exact feature that Jeff is talking about right here, our creative team, get with Jacob, get with Sean, get with one of the two of them. They can actually build your website and include this link on there. So a lot of the agents I know that are on this, I've talked to you specifically how our creative team does logo design, website design. We do help you find your own domains, things of that nature. That is all part of the creative team that we have here. I have the pricing sheet for everybody. A lot of you have received it. If you haven't, get with me. Again, I'm going to follow up on this webinar next week. I have to leave here early today, but I am planning on following up with each and every single one of you next week. Creative team, again, this is a tremendous feature that they can help plug and play onto your website. And Jeff, I'll hand it right back over to you.
Yep, no problem. So that's an awesome service that they provide, that they'll help create that website for you. I really highly suggest everybody take advantage of that. Having a website, if nothing else, just gives you a little bit of credibility when someone goes to look you up online. Okay, but this can be linked anywhere you want to. So in your email signature, on your website, on your Facebook, wherever you like to use it, all you got to do is hit copy there, and that's your client-facing agent link. Okay, so we'll jump back. That is the enrollment tool. Again, you can look up PDPs, Medicare Advantage, MedSup, everything right through here. If you need to search for a profile, all you got to do is type in that name, hit search, and it'll bring that up for you. Now, I've done a million different tests, so you'll see my name in here a bunch of times. If you have somebody, or if you're looking through tests, if you click last update or any of these things, it'll automatically sort it for you. But you can click and go right into the portal or right into anybody's profile at any time. So that's it that I had to show you. Alex, did you have anything you wanted to go over? Any questions? If anybody else has any questions, we can certainly go back and look at anything individually that you need to.
Yep. Nope. I have one question here that I can answer. And
sure.
Everybody, like I said, this is Jeff Pallo. He works with me very thoroughly on the sales side of this. So anytime I have anything, I can go to him for the sales. Do know Pinnacle Financial Services, as I've mentioned before. They are outsourced by us. We do all of our back office through them. I work very closely with Jeff on marketing, strategic planning, making sure we're ahead of the game for all of the agents when it comes to the market. I know many of you, like I said, I am a little bit newer to IAMS, but I do have a pretty extensive background in the Medicare space, just like he does. So there's really not anything out there that him or I probably have not seen, but I will honestly admit I'm learning something new every day. One thing I do want to make sure I mention here, this is one of the two tools that we're offering everybody. So this is one of two softwares we're offering everybody underneath this roof here at IAMS. The other one is that CSG tool. That CSG tool, as I've talked to many about, that is going to do all the live quoting of the Medicare supplement carriers. You can also quote Medicare Advantage, prescription drugs, final expense, and your hospital indemnity and dental plans. But as a really good tool for the MedSups, as I've told you, we now have IAMS quoting on the app. You can get on there and download it's both Apple, Samsung, whatever friendly. You can get on there, download that, use that feature on your tablets to do electronic enrollments and comparisons. This tool as well for the Medicare Advantage prescription drug plans. This is a phenomenal tool. Like Jeff said, these website buildings, that's one thing that we're trying to hit on with our creative team. Everything's moving electronic. I think we can all agree the digital world is very much taking over in the insurance space. So not only can we help you electronically with the comparison enrollment, we can help you with your exposure. And what I mean by that, again, and not to sound redundant, make sure you call IAMS about our website development, logo development. I've had a lot of agents, I think, that because we're doing it privately through our organization, that's going to cost more than going publicly. I can comfortably tell you, if you look at my creative pricing sheet and see what our costs are compared to what the competition is out there outside of this roof, GoDaddy.com, any of these website development type companies, Kinko's for mailbox fillers, anything of that nature, our pricing will beat all of them. I am confident in telling you that. Our pricing is very competitive. We do it as a service to our clients. As I've mentioned to many of you, I report directly to Steve Murray underneath this roof. That is our CFO. He is the boss. And that is one of the features he wanted to add is this marketing service to our agents like yourselves to come underneath this roof. We help you with all this different type of exposure. This Connect for Medicare, embedding that in your website. I've had a lot of agents that do that, and it is really streamlining their business. Same thing with CSG. Many of you I've also talked to, we are developing a new digital marketing lead traffic flow. Make sure you mention that to me because all these softwares and digital marketing for lead traffic and things of that nature, everything is going to come together as one. So again, call our 800 number, ask for me. We're gonna help you not only streamline this business, but help you really gain that traction. A lot of the agents I'm seeing on this presentation today are my annuity agents. Medicare is a phenomenal foot in the door to cross-sell over to annuities and life if that's what your main goal is underneath our roof. We have the Social Security seminar program. When you're talking your Social Security seminar, you roll over to Medicare because what do people want to know? They just lost their group coverage, right? They're retiring. That's why they're at your Social Security seminar. They're retiring or retired. They need to get that rollover health insurance. That's where Medicare is a phenomenal foot in the door because Medicare is a true commodity out there for an insurance because at some point in time you are going to have it. Use that Medicare to get that foot in the door to find that annuity business, find that final expense business. Some of you I know on here, I'm looking at the list, are the financial advisors underneath our roof that are working with the wealth management team, Charles Hiring and his team over there on our wealth management side. Phenomenal foot in the door. Softwares like this that Jeff presented today, the CSG tool, it is going to be able to help you streamline your business, make it as easy as possible, eliminate some of the back office stress. These tools we are providing you free of charge to work through us. Keep that in mind. Jeff, do you have anything else you want to wrap up with?
No, just if anybody forgot, the website is Connect for Medicare. Again, anybody who is contracted already, you already have access to this. So reach out to Alex and we'll get you your login information.
All right, Jeff, thank you very much for joining us this morning on this webinar. Everybody, thank you very much for joining me on this webinar. I really do appreciate it, taking your time out of your day to join this. Again, we are recording this. So once we edit it a little bit, Sean here at our creative side, he will be putting this on our YouTube page. We're getting this moving. We're getting this going. I will tell you one thing we are going to start doing here are live podcast type videos. IAMS has a newly reformed room that we're going to try to do. I believe we will start monthly, rolling it out. If we need to do more, we will. And it is a podcast type program that we're going to be running where we're going to be going over many things that we do underneath IAMS's roof. So not just the Medicare, possibly the life side, and I know some of the annuity side, we're going to get some traction there. Not only live updates of what we're doing underneath IAMS's roof, but we're also going to be talking about actual scenarios that we're running into, because when one agent's running into one scenario, there's many more out there that are running into the same thing. We're going to be going over that, a lot of carrier updates, changes in the market, the annuity and wealth management people on this webinar. We're going to be going through a lot of the different changes there. So definitely keep your eyes out. IAMS, let us help you. Let us help you with your marketing. Call me, 800-255-5055. Give us a call, and I'll hear from you soon. And if not, I will reach out to you early next week. If anybody has any questions, I am going to hang around here and look at the questions box. I'll answer any questions publicly. Other than that, thank you again very much for coming on board, and we'll talk to you soon. Okay, we do have some questions here. I do apologize. Okay, this was asked here. Can you use this for a standalone drug plan? Yes, you can. This is for PDPs as well. Medicare Advantage prescription drug plans. That is on there. We have one, Michael Johnson. I do see your question here. We're going to need to take that offline. That's probably not one that is necessarily that needs to be, that's going to be a more specific kind of case. So we will take that one offline. We'll reach out. I have got to leave here in about 15 minutes to take care of some personal things. I will reach out to you next week, or if you want to, go ahead and email me and we'll talk.
Alex, here's the tab to show you the prescription drug plans.
Hey, thank you very much.
Yep. Switch right over to that.
There's the prescription drugs, like you said. There's WellCare and Vision RX. You'll see some of that right there. Where do we quote the plans? Jeff, will you roll over to where you essentially compare and quote the plan? Will you roll over to that for me real quick?
You want to go to CSG or you want to go through here?
Through here, and then we can show them on CSG as well.
Okay. So this is the quote and compare right here. So all of the information that we entered for the health, for the drugs, for the pharmacy, all factors into this total estimated cost. You can see it lists every single plan here, and then you can select up to 3 and look at them side by side.
Okay, real quick, as he's flipping over to CSG, I have a question here. Is it full commissions and renewals for the Medicare products going through this site? Yes, this will not interfere with your commissions. This is simply an electronic enrolling and comparison enrolling tool, I guess I should say. This is all that is. This does not cost you anything. This is Pinnacle and IAMS. We're covering the cost of taking care of this for you guys. This is simply just something you can enroll on. We use it, but you are still paid the exact same way. All of you are direct with the carrier here through IAMS, so you will be paid directly from the carrier still. There is no interference.
So any other questions, Alex, you want me to show?
It says, yeah, and this one I actually don't know the answer to, so I'm hoping you can maybe answer this for me. It asks, can the applicant see the screens while we are talking to them? I'm assuming if they have a screen share type function on their computer, they can do that, right?
Correct, yeah. So if you're over the phone doing it, they won't just automatically be able to see it. You would have to share your screen with them. If you're going to see them in person, one of the agents, the one who actually uses most often, brings a little second monitor and an HDMI cord and just sits it facing the client. An easy screen sharing site for any of you if you don't want to have to buy one, it's screenleap.com. Screenleap.com. You can share your screen immediately. It doesn't cost you or cost them anything. It takes like 30 seconds to do it. So that's a good question. You can share your screen and they'll be able to see it, but it won't happen automatically.
Okay, we just had another same question again. Will this affect our commissions? Again, this will not affect your commissions. This is purely a software that is provided by IAMS and Pinnacle. As you can see, it's a Pinnacle software. IAMS is we're working with Jeff and everybody very thoroughly on offering these kinds of softwares to our agents as well. It's the same thing as CSG, where I told you we're helping take care of your CSG subscription every year. For all the other comparison and quoting, this is the exact same thing. This will not affect commissions. There's not a fee for you to use this. There's no payment. There's no anything. It is 100% free of charge for you to use. Okay, one of my wealth management advisors just asked if he has agents beneath him, will they be able to get access to? Yes, everybody that is contracted through IAMS will get free access to this tool. So a lot of our agents, I know what I'm doing is I'm gaining some traction. A lot of my peer annuity advisors are wealth management advisors. They are going to contract their agency but not personally produce. They're wanting to go out and find other agents to partner with and work with for them to write the Medicare business and some other plans like that and roll the business over for other leads. You are more than welcome to do that. So when it comes to recruiting and advertising, as I've said to some of you before that are looking to recruit, you can bundle what IAMS is providing you as an agent you can bundle what IAMS is providing you as one to offer to other agents to recruit. I highly encourage doing that. I know Jeff could definitely back me up on that. It is a nothing but assistance to us when you go out there and build your downline, and we are more than happy to help you grow that, service that, work with your agents, work with your clients. Jeff and I both have an extreme background in working with not only individual agents but agencies as well. So everybody is able to use these tools as a recruitment tool, if you'd like, or whatever it may be of that nature, to bring in more business underneath your roof. And again, not to sound redundant, but our creative team, they will help you with your website branding. I have a couple other agents right now underneath our roof that are looking to have our creative team revamp their site as a whole to have a recruiting type platform, to include all these softwares, things like that. So an agent goes to their website, they're thinking, wow, I want to go work with 123 agency. Okay. Our creative team, I cannot stress that enough. They will help you with all these things. Question just got asked about the Social Security seminar. That is that's an insurance agency marketing services tool. Uh, yes, you can. I would suggest maybe not necessarily pulling this up. I don't even know if you necessarily compliantly can show this screen to a theater of people. But if you are doing the Social Security seminar, again, that CSG tool, when you're talking about your Social Security, many of you have showed on how that tool, it shows you the plan details, shows you what Part A covers, what Part B covers, and what the client's out of pocket's going to be and everything in that nature. I would personally suggest you use that over a tool like this. This tool is specifically, it's very complex. It's very complex, as you can see. There's a lot of details. There's a lot of this stuff that a client doesn't need to see at first questions of a Social Security seminar. I think if you go to the CSG tool and show it the Part A, Part B breakdown, and then take it offline from there, from them individually, will not only help you have a clearer conversation, but could also initially start, if you think about it, a sale with that client. Keep rolling in the questions if you like. We have more time here, so if you keep rolling them in, do not stray away.
Alex, just to reiterate, those of you who are looking to recruit agents, this itself is an incredible recruiting tool. So don't be afraid to tell agents that they have access to this and you can give it to them, because there's not a lot of people out there that have the full system quite like this. So certainly use that to find agents for yourself.
Thank you very much for that. Yes, again, and I know Jeff touched on this earlier, but I have no problem answering this one. This tool, this exact tool right here, will only show you the carriers that you are contracted ready to sell with. That does not mean you can send in a contract. You have to have your contract and your certifications. You have to be ready to sell. Could take an app today in order for these carriers to show up on here. So I know a couple of my Florida agents are on here. No, your private Medicare Advantage carriers that you have down there in Florida that we don't work with are not going to show up on here. Now, I'm sure you can use this tool to compare. United Healthcare and Humana is very competitive down in Florida as well. So if you want to take this and type in some zip codes because you're ready to sell with them and show the United Healthcare and Humana side by side, and if you have something separately for your plan down there, you can. But no, this will not show your Florida-based product that you're working. That's a good question. Jeff, could you help me answer this? I believe we're a couple weeks out. We have some agents on here that are wanting to get into Medicare Advantage this year. They have some prospects. They have never been contracted with United Healthcare or Humana before. Do you know what their turnaround time is right now on contracting?
So as long as you do the electronic contracting, so where you'll get a link and complete it through there, turnaround time has been about 7 days, quicker in some cases. So with United and Humana both, you have to complete the link and then you can do your certification. So I usually tell people at least have your AHIP done So then as soon as you get the email from each of them saying that you're allowed to do their certifications, you can immediately upload the AHIP, take their certs, and then you'll usually be approved a lot quicker. If you have all of that ready to go, you can get it done in a week, possibly. If you wait and try to do each step along the way, as you get it, it takes a lot longer. You're talking like 2 weeks, 2.5 weeks.
Okay, we just got asked again about the commissions. No, this tool or the CSG tool will not interfere with your commission payout. You will be paid the same that you would if you were taking paper. This does not interfere with your commissions. This does not interfere with anything like that. This software is provided by Pinnacle Financial, who is, like I said, as Jeff explained earlier, Connecture. That is the same team that runs the Medicare.gov site. That is nothing carrier related. They will not interfere with your commissions. Yes, okay. Mike, I do see here you just asked about a lead program. We do have lead programs through, again, we're actually offering these through Pinnacle. We're mirroring them. Jeff has allowed us to take Pinnacle's lead services, which are phenomenal, to help, to help get your exposure. Jeff, real quick, could you go over your lead programs that you're offering?
Sure. So there's a number of different ones. Immediately, you can get a list of people in your area, whether it's turning 65 or specific income or specific language. Us and IAMS will buy that for you and give it to you same day. Okay. You can also get a list of internet people who had responded to internet leads at some point that they call them an aged lead. So you can get anywhere from 2 weeks to a year old. Obviously, they're a little bit old, but they're a lot cheaper. So they're as little as 25 cents a piece. You can get them same day if you want to. You also have access to internet leads new if you want to do that, where you can buy actual internet leads immediate. Program. If you've never done it before, I don't recommend it unless you've really sat down and talked to Alex or I, and you have a system in place to do it. The other two that we're using the most often are different mailings. So we have a dual mailing for the Medicare, Medicaid plans, the DSNP, that pulls very, very strong. AEP is always a little bit worse, but it pulls usually around 3 to 4%. We also have another program where instead of sending out 1,000 pieces and just waiting to see what you get back, you can actually order a specific number of leads that you want, and you'll know exactly what you're getting back. Okay, and that's just a generic Medicare piece. They're the ones that we're using most often. There are some others that we can help to work with you on, but those are the ones that we're using most often. Obviously, the mailers take time to send out and get back, so you're talking like 3-4 week lead time on that. That's why I brought up some of the immediate ones that you can start and get right away.
Okay, and I do want to touch on that one last time. We, through IAMS, as many of you know, we have our marketing dollar program for our annuity and life producers. We have not done that yet on the Medicare. As many of you know, I've explained to you, I am the first real Medicare producer, advisor, I guess you would say, that they have brought on here. I am the senior health sales director. One of my goals is for 2020 to start incorporating the Medicare production into that marketing dollar system. So stay tuned on that. I have talked about potentially some of our agents. We will come back and look at this AEP, what you've done this last quarter of the year, to apply that to our credit for next year. Again, it kind of depends on a few things. So I'm not going to promise a date, but I am looking for a 2020 rollout where you can use the marketing dollars. Those marketing dollars are there to offset costs of like our creative team, like your lead costs. So you're submitting premium through us, your premium that's approved, we will give you a prorated dollar back, which is very generous actually. It's actually shockingly generous what we give on the annuity and life side. You can use those marketing dollars essentially that you're earning through us to apply towards your marketing leads, whatever it may be. Our creative team, they've generously decided that they're going to allow you to allocate those dollars towards their logo design, website design, all of that stuff. So definitely take advantage of that. Jeff, I feel like you'll be able to answer this in a lot better fashion than I will. Explain the AHIP mandatory, what carriers do require, what carriers do not require AHIP.
So, for those of you who are newer to the Medicare, there are two pieces of the certifications, the Medicare Basics and then the company-specific product certs. The AHIP serves as the Medicare Basics that all of the carriers accept and allow you to use. The only one really of the major carriers that you do not need AHIP for is United Healthcare. They have their own Medicare Basics test that you can take outside of the AHIP. So if you are really new to Med Advantage and you're just starting to try it, you can just get set up with United Healthcare if you want. Take their test. It doesn't cost you anything, and you'll have access to their Advantage plans. Really, all the rest of them do require AHIP. AHIP, by the way, is $125, and you have to retake that every year.
Thank you very much for that.
By the way, if anybody's starting to do their AHIP and have any questions or any issues or anything, just let Alex or I know, and we can give you a few pointers on it.
And I would definitely suggest you take advantage of that if you could. All right, yes, the marketing dollars. Someone just asked me to touch up on that. Marketing dollars, again, they are dollars you earn through IAMS. That is an IAMS incentive. That has nothing to do with Pinnacle. So if you write your annuity and life business through us, okay, and like I said, I am looking to implement this on the Medicare side. Some things have to happen first. We're human. We understand. We will look at credit. If it makes sense, we will give you exactly what you need. But with that being said, it is marketing dollars that you earn through us. Those marketing dollars are to help you offset expenses, marketing expenses, lead expenses, and now we are also anything on the creative team, which I knew I was going to get a lot of traction on that today. Make sure you ask me about the creative pricing again, and I will send that out to you. Anything that our creative team offers, you can offset with the leads. Or I'm sorry, you can offset with the marketing dollars. Okay, I think that does it. So solid webinar. We're here there's just an hour and 2 minutes since we started. So Jeff, thank you very much again for coming on board here. Everybody else, thank you very much for taking the time out of your day. We have some people that lasted here towards the end here with the questions. So again, you have my email, alex@iamsinc.com. Email me any questions. I will have my email on me today. I am having to take off here like right now to take care of some personal things. But again, email me. I'll follow up with you next week. Email me any questions you may have, though, right now if you need it answered. Happy AEP. 'Tis the season of the busy season, as I always say. And happy day. We'll go from there. Thanks for everybody coming on board, and we'll talk to you later.